Hilary Tarkington Stowers, and my company name is Holistic Health and Nutrition, LLC, and the DBA is Hilary Stowers Counseling. And I have a mental health counseling practice servicing people in the state of Virginia.
Okay, awesome. Now, give us a little bit of a backstory about yourself and how you got into your industry and how you ended up choosing holistic medicine.
Sure. It's I'll try to Reader's Digest for this this for you, but
Okay.
basically I was in a completely different field and I didn't really have any passion for it, but I was plugging in my skills and abilities and traits into this other field, and I was in it for quite some time, like 20 plus years. But unfortunately for me, I contracted Lyme disease unknowingly in 2001 when I lived in California, and I went on to be quite ill for the next 9 years, and found some holistic doctors when I relocated to Virginia, where unfortunately Lyme disease is endemic. And it took them a couple of years, but they finally diagnosed me with chronic Lyme. In the meantime, I was learning about like how nutrition impacted health, and I had decided to go back to school up in New York City and get certified as a holistic health counselor. And the school I attended at the time, well, it's called the Institute for Integrative Nutrition, but it was brick and mortar back then, and now I think they only do online.
Okay.
So I was starting around, this is probably like the summer of 2010 after I graduated, starting my own holistic health counseling practice geared towards nutrition. And my niche was people who had received a diagnosis and needing to relearn how to cook and grocery shop and eat for their newfound condition. And naturally, the specialty within that was Lyme disease. So while I had my day job, which paid the bills and had insurance through that, I would follow my passion nights and weekends and counsel people. And I partnered with what we call LLMDs, Lyme Literate Medical Doctors, or LAMPs, Lyme Aware Medical Practitioners, in Loudoun County, and help support people either through individual counseling or doing talks like at Ida Lee, where I've also been a spin instructor since 2007.
Wow.
Educating people about the role nutrition plays in recovering from Lyme, chronic Lyme disease. So I did that for a long time, and then my clients started to change, people coming to me more under the auspices of wanting to lose weight. And then I would realize in working with them, this really wasn't about the eating or the weight. It was about like maybe someone had been sexually abused as a child and never told anyone and became an emotional eater. Or perhaps they were in a really toxic marriage and they were eating out of rebellion. And I'd have success with them in essentially determining this is the root cause. This is why you are doing this behavior. So then they would want to refer their friends and family to me. And I was like, I'm just a certified holistic health counselor. I'm not a therapist. So this was at the beginning of 2020. And I just thought, why not me? And then I decided to pursue exploring going to graduate programs. So I kind of blew up my life in my 40s and transitioned out of working in my previous field and went to George Mason University through I got a master's in education with a concentration in clinical mental health counseling.
Nice.
So I did that and worked for an agency when I was interning, and then decided, because I'd already had the nutritional arm of my practice, to roll out the mental health counseling arm and really try to integrate the two. So I take a holistic approach when I'm working with mental health patients and take into account things like their nutrition and health, and just take a macro view, I guess.
Yeah, absolutely. And now for those just getting to know you, what exactly is holistic counseling and how does it differ from traditional therapy?
Okay, so I would say, kind of playing off of how I just answered, is that when you're doing traditional therapy, you're doing different forms. It could be like CBT, cognitive behavioral therapy. It could be any type, acceptance and commitment therapy. There is a whole, what I call, toolkit of different types of modalities that you could employ. That's the more traditional approach. And I'm trained in all of those theories and modalities, and I call it my toolkit. I take more of an integrated approach. But I think what sets me apart is that I have the traditional, or I have the non-traditional training in nutrition, and I've also had a lot of my own medical challenges. So when I'm looking at a person, if they come to me presenting with anxiety, I'm like, what's the root cause of the anxiety? So is this situational? Are you in an unhappy marriage? Are you estranged from an adult child? Is it event-driven? Did something acute happen that is now causing you to have anxiety resulting in panic attacks? Or are you maybe 52 years old and you're a female who is perimenopausal or menopausal, and then your symptom is anxiety? So it's really important for me to look at the whole person and what's going on. And I don't purport at all to be a doctor or have medical expertise, but I do partner with a lot of doctors. It ends up being, most of the time, I'll call them HRT literate, hormone replacement therapy literate MDs, who are oftentimes OBGYNs. And I also partner with naturopathic doctors and other people sort of in that realm, just to make sure that people are getting the care that they need from who they need it.
Absolutely. And we talked earlier, and you had mentioned the term, and maybe I'm going to butcher this, but what was it? Gaslighting, medical gaslighting?
Mm-hmm.
Tell me what that term is and what that means, and how it's becoming an issue, or maybe it's been an issue already in the medical field for some patients.
Sure. Well, I think I could speak to it on 3 different fronts. First, having Lyme disease and being misdiagnosed. Second, I have another condition that I don't think is necessarily rare. I think what's rare is that it is underdiagnosed, called lipedema. And thirdly, I am a woman of that age where your hormones start to tank and you need hormone replacement therapy. So when I had the Lyme disease, I was misdiagnosed by a dermatologist in La Jolla, and I had a bullseye rash and everything.
Oh, no.
And I went from being a really healthy, fit 20-something who would bike, walk, or jog to crew and row for 2 hours and walk, bike, or jog home to I was almost in a wheelchair. It went into my brain. Lyme disease is known as the great imitator, and it attacks the weakest systems and organs in your body. So it went into my brain, and I would have complicated migraines with neurological side effects. It went and attacked my thyroid, which caused the other condition, lipedema, to flare up. It went to my back, just a myriad of different symptoms. But the thyroid was the main and initial presentation. And so I went from that healthy person to gaining a ton of weight, becoming extremely lethargic, and it was just this huge change. And I would go to endocrinologists who specialize in thyroid. I can't tell you how many that I went to, but they just kept treating the symptom, which was thyroid, and not trying to get to the root cause. Again, going back to your previous question, why it's important to me to treat people holistically. And I wasn't getting better, and they would just put me on a synthetic drug. Then they would put me on Armour thyroid. Then they would put me on a compounded drug. So they weren't really listening to me. They weren't really believing me, and just kind of questioning it. And I had to fight like a dog in the street.
Oh, man.
And be like my own patient advocate to get someone to listen to me. And it took, like I said, 9 years to get a diagnosis.
Dang.
So yeah, and I'm very grateful to the holistic doctors who did diagnose me. And so I experienced it on that front. And then the lipedema condition, it is something that affects 11% of the population, mostly women. It's probably more than that because I think people are underdiagnosed. And it is a lymphatic disorder, a connective tissue disorder. Some doctors are saying it's a collagen disorder, and it's a fat disorder. It's not to be confused with lymphedema, which oftentimes affects breast cancer patients. So essentially you have an unusual presentation of fat, more fat in your legs, and there are 4 different stages of it. Of the 11% who are affected, it also affects 80% in their upper arms. But the lymphatic system is self-pumping, and you have an impaired lymphatic system. You bruise easily, you have very soft skin, you take a long time to recover from any type of injury to your leg. If you get a cut, a bug bite, anything like that. You often have other comorbidities like Ehlers-Danlos, which is hypermobility. You might have an exaggerated histamine response to a bug bite, for example. You might have MCAS, which is, oh my gosh, it just escaped my mind, but it's another, mast cell activation syndrome, excuse me. So you might have some of those things going on. So when it flares up, is times of hormonal change. So when you're a younger girl at the onset of your period, if you get pregnant at that time, when you enter perimenopause or menopause, it can flare up during those times. For me, it flared up because the Lyme disease attacked my thyroid. Thyroid regulates hormones, and so then the lipedema kicked in. So doctors were asking about what I was eating. Well, I had been a fitness instructor since 2007, very active despite the Lyme and just kind of fighting through.
Wow.
And also I was as of 2010, a certified holistic health counselor. So I was shopping at the farmer's market every weekend, eating organic. I gave up gluten in 2008, could not take weight off, no matter how many rowing classes I took, no matter how many Pure Barre classes I took, no matter how many spin classes I taught. So just a lot of those doctors like wondering why my weight had gone up. So, and the third arm of that, going to that demographic of women in typically their 40s and 50s, starting to experience hormonal changes because your estrogen starts to go off a cliff, progesterone, DHEA, even testosterone, we as women have that as well. And so it manifests in different ways, not just hot flashes, not just night sweats. It can cause anxiety. It can cause gluteal tendinopathy. It can cause ringing in your ears. There's just a long list of symptoms that I don't think people are familiar with. And if you get a doctor, whether it's your primary care or an OB, and they are not HRT literate, hormone replacement therapy literate, then they're going to tell you to white knuckle it. And there are so many things that can be done to help you. And there were studies done in 2002 correlating HRT to breast cancer, and those have since been debunked. There's a wonderful doctor out of Texas named Mary Claire Haver, and she's really spearheading education on this topic. And I think she tells people to go to menopause.org. And that way, if you're really struggling as far as finding a practitioner who's qualified, there's a directory where you can find practitioners who've taken additional training on being literate about HRT and menopause in general, because she talks about being a med school student, I don't know, I guess it was maybe over 30 years ago, and how they got virtually no training. Same thing on Lyme disease. One of my good friends is a doctor, and at the time he worked in the ER, and he asked me to help educate him on what signs to look for Lyme disease. And also the medical field doesn't get any training in nutrition. So when the people who are treating us are not educated on Lyme disease, women's health, nutrition, all of that stuff, then they are ill-equipped to handle some of these things. So a lot of women are maybe experiencing traditional or non-traditional symptoms outside of, as I mentioned, something like night sweats or hot flashes, and they're being dismissed. And you can meet with a naturopathic doctor. You can meet with a regular MD who's literate in that field. And you can get like creams, patches, they're all compounded from a compounding pharmacy or called bioidenticals, or something oral that you can take to mitigate your symptoms. You don't have to suffer.
Yeah, no, and I want to add to that a little bit. I'm very self-aware about like ticks. Every time I go out, I check, I tuck my socks in my pants or vice versa. I had a tick one time. I didn't feel well, and I went to urgent care, and I brought the tick with me, and I asked them like, can you run tests and could you do something? And they were like, no, throw that away. Oof. So I was just like, okay. And I'm like, I'm just going to save it. So I like kept it in the freezer, and then eventually I just threw it away because I was like, what if I had something, I don't think that I do. I feel fine, but you never know, right? But isn't that wild? Like, at least give me like an educated answer of like why you won't do that. They were just like, no, just throw that away.
First, I want to say I'm sorry that happened to you. That is a version, what you just described, of medical gaslighting. You did the exact right thing. You just went to the wrong place, but you didn't know it. And that's the thing is...
I didn't know what to do. Like, do I bring this? Are they going to laugh at me? Do they even know? Because I read online, but do they even know or care about that?
That was their ignorance. You were correct. You bring the tick, and then labs that know what they're doing, doctors who know what they're doing, they test the tick to find out what strains it has. Because Lyme disease, and this is a tell, if a doctor says Lyme's disease, or any medical practitioner, they don't know what they're talking about, because it's named for Lyme, Connecticut, where it originated. That's where it's suspected to have originated. So Lyme is an umbrella term. You could have Bartonella, you could have Babiosa, you could have all sorts of different strains of the disease. So someone who knows what they're doing would have tested the tick, and then they would know, okay, she potentially could have been infected with this strain or whatever multiple number of strains, and then they would pick antibiotics that are targeted to address the strains you had. If people aren't fortunate enough to have the tick, then they'll typically just treat somebody who has a bullseye or knows they were bitten with maybe 4 to 6 to 8 weeks of doxycycline, depending on the patient, depending on the doctor. But you did the right thing. They just were ill-equipped to help you.
Okay. And I just wanted to make sure I was okay because I was like paranoid and I was like, I hope I'm okay. My husband just kept like saying, like, you're fine, you're fine. But anyway, like, see, these are some examples that maybe people need to hear, ever be aware of me. Like, I didn't know I was supposed to bring a tick. So I just wanted to touch on that. And thank you for talking about that because I think it is important. And I'm glad that you are advocating for people and you also want to help educate and teach them. So like you mentioned before, so they can be self-advocators for themselves as well. So I think that's awesome. And then I want to ask you, you've mentioned helping women reignite their spark. What does that phrase mean to you? And where do you start with someone who feels dimmed by life?
Okay, so the way that I see it, because it's very visual for me, I'm a visual person, I'm a visual learner, is I think every human being has like a flame kind of in the center of their chest, and I want it burning brightly. And so for whatever reason, if your light has either been self-dimmed, you've dimmed it yourself out of self-preservation, or someone else, like a partner or maybe a toxic boss, they've snuffed it out, I want to get it flaming again, because that means you're kind of in survival mode and you're just on autopilot. And a lot of times this is happening to women and they might be in a toxic relationship or, like I said, working for a boss who's similar as far as the profile. And they're trying to earn a living and they're trying to deal with perimenopause or menopause and they're trying to raise their children and they're trying to maybe do something in their community. And so if they're kind of shut down, then their intuition has been dulled or dimmed or snuffed out. And I feel like if you don't have your intuition activated, if all cylinders are not firing, then you can't make the best decisions for yourself and for your family. And oftentimes with women, they're mothers and they have a multiplier effect. So if I can kind of sit down with them in sessions and unpack what's going on. Are you going through a major life transition? Did your partner die? Are you in an abusive relationship, whether it's professionally or personally? Like, what is going on in your life that's caused this to happen? And let's try to figure out how you can reclaim like a sense of agency and make better decisions that are aligned with your goals, the future you desire, and the person you want to be. So whether that means like maybe you need to leave your partner, maybe you need to get another job, maybe you need to address an issue with an adult estranged child. Maybe you need to address something that happened to you when you were much, much younger that you thought you had gotten over, but it's starting to pop up in your life now in different ways, whether it's like through a relationship or, just in the form of anxiety or depression or whatever. But it's just so crucial, like that every human being have this fire, this flame, this bright light in their center that they're able to operate out of. And it's just so important to me that we get people tuned into that at a young age. And it's whether, I'm teaching my own nephews about that from very early ages, or if I'm teaching my clients, because I typically see adults, about that concept, then they can help their children or, young people in their lives or other people in their lives kind of have an awareness about it.
Absolutely. And then I want to also touch on mental health in general, how if that is not taken care of, how everything around you or in your life or yourself could fall apart, and why that's a key important subject to talk about for people, because maybe they're going through things and they don't think it's mental health. They're like, oh, I need to take some medicine for this, or maybe I need to just go do exercise, which does help. But if you don't address the issues that are going on with mental health, talk to me how that nothing will go like right for you. Essentially, like there will always be times where it's going to be difficult. You're going to keep spiraling unless you get, help or talk to somebody or address those issues.
I think the way that I want to answer this is my parents are much older and wiser. And they would say, if you don't have your health, you don't have anything. And they said health in a very broad sense. So clearly this covers physical health. If you have something physically where you're in pain, it's everything else just kind of falls away. But I think we should put an emphasis on mental health as well. And sometimes it could be like generational, sometimes it could be cultural. I have a dad who's 80 years old, and he was of the era where people would talk about like going to a shrink, talking about going to a psychiatrist. And he's also of that ilk, you kind of just like get over it. Like
Brush it off.
power. Yeah. So I just want to acknowledge that sometimes that's a byproduct of your generation. Sometimes it's a byproduct of your culture. Like there could be different reasons why people tend to shy away from it. And also people may have the wrong impression where it's like, oh, you're crazy and you need help. And it's like, no. Everyone goes through different life transitions where they could use a neutral third party to help talk them through. So it could be a job loss, it could be a divorce, it could be challenging parenting issues, again, going back to toxic relationships, it could be any of those things. But if you don't address it, it's like whack-a-mole. It's going to constantly pop up someplace in other places in your life. Sometimes there'll be folks who maybe their coping mechanism, a maladaptive coping mechanism, is to internalize things. So they might appear to everyone else to be fine, but they're internalizing things and it's eating them up inside. And then their baseline for patience is really quite a bit lower as far as their threshold. So something minor is going to set them off. And I don't even know if they make the connection. Like, I've internalized all of this. I'm so unhappy with whatever, insert, issue here, that when something relatively minor occurs, that they have kind of a hair trigger response to it. And I really want them to think, like, what's going on? Like, why am I maybe having an outsized reaction to something minor? So really just getting yourself the help to unpack whatever issues are going on in your life, it helps you stay calmer. Like, we do things like, in my sessions, like breathing exercises, or I'm trained in EMDR, eye movement desensitization reprocessing, which is used to treat PTSD or even used to help people like prep for interviews or prep for exams. And just kind of do exercises with them where I get them calm and centered. There's a lot of like visual, guided visual imagery, things like that. But my message is pretty much, you don't have to suffer either. The same way I was saying about HRT or Lyme or whatever, you don't have to suffer. You can talk to someone and this isn't your sentence. Like, things don't have to be this way. And I mentioned initially about physical pain. If you are in emotional pain, if you are in emotional distress, you are suffering. And if you have been taught, like, just white knuckle it or just get over it, or I don't have time for myself, that's another thing I see. Yeah. A lot of women who put themselves last, they're like, well, I'm a mother and I'm a wife and I'm a sister. Or even if you're in a sandwich generation where you're helping still take care of your own children, but then you have aging parents, like, you feel like, I can't afford to take care of myself. But it's that old adage, put your own air mask on first. You are no good to anyone else if you don't take care of yourself. So sometimes, we as women in this culture don't feel like we're entitled enough to take that time, because it's just like, this martyr thing. Like, you've got to be a mom, you've got to power through, you've got to work, you've got to do this. Nobody asks a dad, how do you do it all? Can you have work-life balance? Nobody's asking a dad about that. Or someone's like asking the dad, you're babysitting your kids. He's not the babysitter, he's the father.
Yeah.
And my girlfriend and I were talking about this the other day, how a lot of times when men are caregiving, like, she was giving an example of, it was like her husband or cousin or somebody was at the airport with a baby, and it's like, everybody stop to help this man. Like, help him get his child.
Help, poor him.
Yeah, help him get his child a diaper, or like, just they kind of like, or I think it was that was her cousin's husband, and then her husband was taking their children to the doctor. She's a full-time working mom, he's a full-time working dad. And so anytime she shows up at the doctor, they're like, oh, mom's here, kind of like, she's not sticking to the prescribed role.
Yes.
So I think that is the unspoken cultural pressure that a lot of women feel. Mm-hmm. And it's just like, speak up, stand up. It's fine to have needs. I mean, sometimes I'll ask a woman in an initial session, or maybe the second session, what do you want? And I've had people just start crying because they haven't been asked in so long what they want.
That's so bad.
That, it's just, they haven't even thought about it. They don't know what they want because they're so busy making sure everyone else gets what they want.
Yes. Oh, man. This kind of hurts, but it's okay. I need to hear it. I want to go back to EMDR and what that's like. What is the experience like when you're getting that done? I'm very curious. You said it was like visual.
Well, there are different aspects to it. So Dr. Francine Shapiro designed this in the 1980s, and it was initially created to help military people with PTSD, and PTSD, post-traumatic stress disorder. I don't even really believe in the D, because I think if you are exposed to something traumatic, that you're having a natural human response. But I'm not going to, argue with what's called the DSM-5 in my field on that right now. That's just my personal take. So she learned, after having success in treating veterans, and I'll explain a little bit about what it is, that it could extend to other people. It could extend to people who've experienced trauma for different reasons, whether it's something significant like sexual abuse, or like I mentioned earlier, it could be something to help you prepare, feel like you have the resources to prepare to do well in an interview or to do well on a test. Or even I've used it on a client for a breakup. He was having a really difficult response to breaking up with his girlfriend, and that was successful. But what it is it uses something called BLS, bilateral stimulation. And I use tappers that alternate vibrating, but some people will use fingers and do hand movement. Some people will use what's called butterfly tapping, sort of lower like this or higher on the clavicle, especially if you're doing it over telehealth. But in person, I like to use the tappers. But what is happening is you're using this BLS and getting people to take memories that are stored in a maladaptive way, like a really terrible memory, and get them to reprocess it so it's stored in the brain in a more adaptive fashion. So then they are less hurt by whatever happened to them. So the way that I would describe it, and I will self-disclose, and I tell my clients I only self-disclose if it's therapeutically beneficial to you, but for the purposes of this interview, I was hit by a car as a pedestrian, and so I went to an EMDR therapist to have her help me reprocess the car accident. And this modality has about an 85 to 100% efficacy of resolving the incident if it is an acute single incident in one session. And that happened for me. This is well before I was ever trained in it. So I felt like it would make me a better practitioner to have been on the receiving end of it. And then I also went back to the same practitioner for EMDR when my mother died. My mother had cancer. And thank you, I appreciate that. And she was a wonderful woman, and I was very blessed. But my dad and I believed that she left us on a Sunday, but her body hung on until Friday. And it was really awful to watch this. And so I went back to this EMDR therapist and had her help me reprocess the last few days of my mom's life. That took several sessions because it wasn't acute, but it was effective. And the way that I describe what happened to me is it was almost like gauze was put over the visual, kind of buffering it for me. And when I have done EMDR on my clients, I've heard them describe it like the incident seems more historical than traumatic. The incident seems almost farther away in distance or proximity. It just seems like that it's more palatable for them. So that's something that I really like to keep in my toolkit. Like I mentioned earlier, I take an integrative approach. So I have all different things, and it's not a one size fits all. I meet the person, the first few sessions are getting to know them, and then I need to tailor their plan. Not everyone necessarily needs EMDR. But it's a really good thing to have.
Yeah, no. And if people are curious to try it, or maybe nothing's worked and they find that maybe this has helped them and they're not even aware of this service, like, do a lot of doctors offer this, or is it particular?
I actually don't know of any doctors who offer it. It's typically, and that just might be me, but that doesn't know. But
or therapists or counselors?
It's therapists. So in the state of Virginia, you're known as a licensed professional counselor. I'm considered a board-certified resident in counseling, and I'm also a national certified counselor. I'm also a certified grief educator, and I'm trained in EMDR. But the people in this state who would be able to do it are typically LPCs, LCSWs, which is licensed clinical social worker, LMFTs, licensed marriage family therapists. Those are kind of like the main folks who tend to have the training. I don't know as much about the psychiatrists because they go to medical school, and I don't know, it probably just varies based on the doctor if he or she wants to pursue adding that modality. But the psychiatrists are helpful to partner with for med management.
Okay. And that experience, just because I'm still curious as well, for some people, you said it's kind of like historic and not traumatic, but hearing about it and like kind of thinking about like you know, maybe if someone went through something and like putting yourself mentally in that space, it kind of sounds scary.
Mm-hmm. You are very intuitive. It can be. So what we do, or I'll speak to what I do in the training that I received. The training I received is through EMDRIA. And it's a great organization. Actually, one of my good friends who's in LCSW in Maryland, she's becoming a certified trainer, because you need people who are certified to teach people like me. But what we will do, we don't just jump right into it. Like I said, I need to get to know the person. And then I have a few exercises that I can do with them to help prep them. One of them is called container. And essentially, like, I do this guided imagery. This is where I have them close their eyes. This is not involving the tappers, but I will walk them through, like, coming up with what does a safe space look like? Because this is something that happened to you that's affecting you, but I want you, through this visual imagery, to put it all in this container. And I'm really kind of abbreviating how the exercise goes, but it's so they feel like they can put it away and access it when they need it. So it's not constantly over them. That's one tool that we'll use to help them prepare. There's another activity called Safe Calm State. That is also guided imagery and with the tappers, where I essentially walk them through this sort of visual. And at the end of the exercise, what I'll do is I'll get them into a very relaxed state. And then I will ask them about something that agitates them, but on a scale of 1 to 10, just like a 1 or a 2. And then I ask them to kind of get in touch with how they're responding. So if they went from this like super calm state to like describing like, oh, you know, like my shoulders are starting to tighten up or my jaw's clenching or something like that, then I'll take them back to the safe, calm state. And then when the exercise is done, the purpose of it is, or part of the purpose of it is to demonstrate, look at how much control your brain has over your thought process. So when I do EMDR with people, I say, you're not doing the work. I'm not doing the work. Your brain is doing the work. So I've had people tell me, you know, it's a really trippy process. And now this is outside my scope, but what's becoming really popular is ketamine-assisted EMDR. So
I've never heard of that.
It's really severe cases, typically. People who have very traumatic memories, significant, we call it in our world, CPTSD, complex PTSD. And so you need a doctor, obviously, for the ketamine prescription. They can do it like liposomally in your mouth. Some people will do IV, but you also need a clinician who's trained in EMDR to do the EMDR in conjunction with the doctor who prescribed it. But for anyone who needed resources like that, I would be happy to refer out. And that's something I'm very big on, is that if it's outside my scope, I don't touch it. I just say, hey, I'm pretty well networked in this world, and I'm happy to refer you to someone else. And I always offer a free 15-minute consult, because I want a potential client to get the feel for me, because I'm not for everyone. And then if I'm not for them, my ultimate goal is getting them to someone who is for them. So I'll refer them out. And even sometimes if someone has said that they want to work with me, if they have specific issues, I might say, hey, here are 2 or 3 other clinicians where this is their wheelhouse, because I really want them to be sure. And if it's not me that they pick, that's okay too.
That's okay, yeah.
I feel like it all comes around. And ethically, the patient's best interest is what we are supposed to focus on.
That's right.
And operate in an ethical manner. So I want them to have choices, and they might not know of who else is out there, but I do. And if it's something way more significant, like we'll say extreme disordered eating, that's not my wheelhouse. Even though I'm trained in nutrition, that person might need inpatient care. Historically speaking, eating disorders, particularly anorexia, are the most deadly of the mental illnesses. So that's something you want to make sure you get to the right person. And I typically don't treat people with access to disorders like schizophrenia, bipolar, things like that. They need med management. And there are some therapists who will work in conjunction with their psychiatrist, but typically that's not my demographic.
Specialty. Okay, yeah, no, that's good to know. Let's talk about misconceptions. What are some misconceptions people have about holistic health, and how do you help clients break through them?
I would say the people who are typically drawn to me already have a buy-in. You know, like they might already shop at the farmer's market. They might already shop at the health food store. They might already see an integrative alternative doctor. The people who think holistic is like too woo-woo, they're not going to be attracted to my practice. And that kind of goes back to what we're talking about. If someone's particular age or the way that they were raised or their cultural background, if it's just, there's too much stigma to it, they generally don't even approach me. So I don't have to defend it.
Yeah.
I don't know if that's exactly the answer that you were going for, but
No.
I just don't really encounter it that much
Yeah.
because they're not drawn to me.
Yeah. And that means that you made it clear about what you specialize in and the type of work that you do, that people who come in, they know that, and they're actively looking for you because of those purposes.
Mm-hmm.
Whereas others who are more like, maybe not as open-minded, are like, well, that's not for me. That's fine. I'll go over here. So I think you've branded yourself well, where people know like, hey, she's for me. I'm going to give her a call. This is what interests me, and I want to give that a try.
Thank you.
You're welcome. Is there anything I have not touched on that perhaps you would like to share, whether it's about yourself, the services you provide, your industry, maybe a fun fact about you? You have the floor.
I would just say, I mentioned earlier that I'm a certified grief educator, and this is something I'm very passionate about because of being close to my grandparents. My grandparents lived to be 102 and 103 years old. I know, very lucky. And they were married almost 78 years when he died. And I helped take care of him. And we had professional caregivers, and my dad was kind of the point person that I would go out and take care of them as well. And my grandmother passed away in July of 2022, so I went on to take care of her as well. They lived long, happy lives, so it wasn't tragic or premature, but you have, at that point, 40-plus year bond with these people. And there was a lot of grief in that, but it was, I would say, what's to be expected. And then unfortunately for me, my mom, despite no family history of colon cancer, or cancer at all for that matter, my mom got colon cancer, stage 3 colon cancer, and was diagnosed at the beginning of January 2020. And right when the pandemic was descending upon us, she had to have a major surgery in that March, and it was like a 5-hour surgery. And she, went on to try to fight this for the next basically 3.5 years, and ultimately succumbed to it. It turned into something called peritoneal carcinomatosis and died in August of 2023. So that fall, I was in my last class on campus in person, and it was social justice. And I chose a project for the entire semester about aid in dying, medical aid in dying with dignity. And I educated my peers and my professor and myself on medical aid in dying. And a lot of people who are opposed to that are typically have more of a pro-life stance. And I think it's just because they don't understand how it works. And there are only 10 states in this country and the District of Columbia where that's legal. So after I saw what happened to my mom, which I knew she would never have wanted to happen, I really feel strongly that that's something that needs to be changed in the state of Maryland and, quite frankly, every other state. And if people understood exactly what is in place to prevent it from being abused or misused, I think they'd feel more comfortable about it. But that leads me to the grief. So that following spring, I decided to take this course with a gentleman by the name of David Kessler, and it's Kessler. He's very well known nationally, and now I'd say it's fair to say internationally, for being an expert in grief. He's like in Oprah's orbit, if that tells you anything.
Whoa, okay, he's up there.
Yeah, so I took this grief educator course, and it was very, very helpful, and there were 3 different areas that they were training people for. So they were training people like me who were therapists who wanted to add the title of certified grief educator to their resume and to be able to help that population. And then there were people who are kind of in adjacent fields. It might be like a pastor or a rabbi or a hospice nurse, or I should say a hospice worker or a nurse, people like that, who also wanted to complement their existing skill set. And then the third group was peers. They wanted to have peer-to-peer educators, people who maybe had lost a child to a drug overdose or had lost a family member to suicide. And his website is just grief.com, and they have a subgroup called Tender Hearts, where if you have, for example, let's say you lost your spouse, they don't just have like a support group for widows. it's broken down. Like if you're 40 and you lost your husband and you have 3 kids, your needs and your experience is very different than someone who's like my father, who was 78 when his wife died.
Yeah.
And so they really try to make sure that they get you dialed into the right support groups when you need that. So I am passionate about making sure that we do a better job in this country about becoming grief literate, because what I've seen is thoughts and prayers. That's what a lot of people say. Or sometimes people say the wrong thing, and I know they're well-intentioned, but they might say like, God doesn't, give you more than you can ask for,
Yeah.
or God needed another angel, or, at least he's not suffering anymore. Like I said, everything, people are well-meaning, but the person in grief does not want to hear any of those kind of cliche sayings. And I have to say, like, I'm not ungrateful for all the beautiful flowers that my dad received and my husband and I received, but our house started to turn into what looked like a funeral home. And my dad had been caring for his dad, his mom, and my mom, then my mom, for years. And it was just like another living thing for him to take care of that was going to die. So you have basically this kind of need to re-educate people about how to sit with grief, because the other person doesn't know what to say to you. And then they run the risk of potentially saying the wrong thing. And just like showing up and being there and not asking the person like, oh, just let me know if there's anything you need. Well, that person's in grief. They don't need a to-do list to come up with something to tell you to help them.
No.
Just show up with a casserole. Or even I heard on a podcast once, everyone made dinner for everybody, but then they had no breakfast. So they needed breakfast meals.
Yeah.
And I was counseling someone once in grief, and the person was telling me that there was like a neighborhood spreadsheet of who was making what dinner for what night. And then these 2 families crossed wires and they both brought dinner for that night. And then the family hid the first dinner because they didn't want the second family to feel badly. So here they are in grief, but they're like still worried about everyone else's feelings.
Yes.
So there's that. And then there's like the professional aspect of it, where your boss or your office or your corporate culture, whatever it is, they want you to come back to work. There's very little that I've known of bereavement leave, let alone bereavement pay. And I think whether it's at work or in your personal life, people just want you, the person who's grieving, to get back to normal, and your normal doesn't exist anymore. So you become someone different, and they, don't know exactly what to do with you. And this extends well beyond grief in a traditional sense.
Yeah.
Like you can have grief because your marriage is falling apart and you're grieving the future that you thought you had with this spouse and this family. Or if you're a person, like with what's going on right now with the federal government layoffs, let's say you're very heavily intertwined with your career, and you heavily identify with your job, your profession, and you've been laid off, then you're like, who am I now? Even the death of pets, sometimes people underestimate like how much that companion and the loss of that companion can impact you.
Yes.
So I think that grief manifests in many different ways. And even when we were talking earlier about a parent or a partner who didn't show up for you in life the way they should have, whether it's something extreme where you were verbally abused, emotionally abused, sexually abused, whatever it is, or neglected, there's grief for the parent you wished you had. And if they're still alive, if they can't change, there's grief for like, you're still not who I need you to be. So I want to support people in grief, and I want to kind of spread the word about how to better support those in grief, and even just sitting with them. Like in the Jewish faith, they sit Shiva. They go to someone's house, whoever passed away, and they just, sit with them. They might bring in food. They might, I don't know, just sit there and knit or play cards or something, but just being with the person, and you can't fix it.
No.
So just kind of your presence
Be there.
Yeah, could be more than you ever know.
Wow, you dropped so many mics, bombs, whatever you want to call them. Amazing, so much information, and I agree with a lot of the stuff, not to be biased or anything or with anybody on the show, but I love what you said, and I resonate with a lot of it, and I hope people who listen to this will resonate with it, because there are so many things that happen in our world or society, and just even grief, the words that you were saying, even, I guess, I don't want to go back to that, but I don't know, I hope I'm not being rude, but when you said that, when your mom had passed away, and I was just like, I'm sorry, because I do genuinely feel sorry, but maybe, I don't know if that was not the right thing, but I honestly feel like with society, like there's certain phrases that it's kind of like, not disingenuous, but it kind of is almost like a switch, like you need to say those things, like God doesn't give his silliest clowns the hardest battles. If he knew you couldn't handle it or whatever. I think people kind of regurgitate what they hear in like the movies, or like somebody said that and it just continues on, but it's not kind of sincere sometimes. It's just like when someone holds the door open for you, you say thank you, right? Like that's great, and that's great manners. But when it's grief, people are really dealing with stuff, and sometimes that's not what they want to hear. Maybe they need comfort. Maybe they didn't have comfort from that person, or they felt like that they could have comforted them more, or whatever the reason is. But maybe they just need someone, or maybe they need space, right? But maybe communicating and talking like, hey, I'm here for you. If you need me, you can call me. Let me know if there's anything I can do. If you need help with whatever, cooking a meal, or like I can take care of your laundry for you. I understand this time is like really hard for you. I'm here. I don't want to intrude, but know that I am here. And I love that you got to talk about that and so many other things with like health, mental health, nutrition, and just I want to thank you so much for coming on here and sharing all of that and wanting to spread that to other people. So,
well, it's my pleasure, and you were just fine saying that you were sorry. And I will say, in this age of AI, people can go on ChatGPT and they can be like, what are some things I could say? You could look that up for if you're sending a condolence card or a sympathy card. Like, what are some sincere words? I think if someone is truly genuine, it does come through. So if someone is disingenuous, that may also come through. But just the fact that you care enough to try to pursue something to help a person, that's what matters.
Yes.
And if someone is lucky enough, someone in grief, to have a lot of friends or a wide circle or a big community, whatever you want to say it, a lot of family, they might choose different people to go to for different reasons. Like this cousin of mine might make me laugh all the time, and I want to see her when I want some levity. And then if I am feeling like I'm going through the 6 stages of grief, because there are 6 stages to it, David Kessler added the 6th. He was trained by a famous person named Elizabeth Kubler-Ross, who wrote the first 5 stages. He wrote Finding Meaning. So you might be like in anger, or you might be in sadness, or you might be, in different phases. But if I could go to another friend and just be like, I'm so angry. Why was my mother taken from me? You have different people for different outlets, and they can serve different purposes for you.
Yes.
Or someone who's just like a comforting, familiar face who you might just want to see and watch a movie with.
Yeah.
That kind of thing. But I think just the effort, the fact that you were talking about like, I want to put forth effort, that matters a lot. And we had a neighbor recently, our neighbor of 20 years, and he succumbed to pancreatic cancer after 5 years. And he was in a trial at Johns Hopkins, which he's the only person I know personally that lived as long as he did with pancreatic cancer. And shortly after he died, I brought breakfast burritos in for his wife and child, just showed up with the breakfast burritos because I try to practice what I preach. And then his memorial service was several months later. And I showed up that morning of the memorial service, and I brought her a wrist corsage, and I brought a boutonniere for her, the son, just so they felt special and like they could look down or at their wrist or at his chest and think like of their dad. Just those are the kinds of things I mean. Like, just do something.
Yes, I agree. I love it. Again, thank you so much. And it's been a pleasure having you here. And I'm glad that you decided to be a guest here.
I'm glad to have been invited. Thank you for your time and your interest. And I really appreciate you listening.
Absolutely. We did it.
We did it. Do you want me to take the